Hi, and welcome to episode 16 of the Shakopee Chamber Podcast. My name is Angie Whitcomb. I'm the president and CEO of the Shakopee Chamber of Commerce, and I am pleased to welcome you here with us today. And thank you for listening. As you know, if you've tuned in before, we started this little podcast back in June as a way of staying connected with our members and our community in a time when getting together to stay connected was strongly discouraged. And we're still there, so we're still doing this podcast, and we're having fun with it. And we hope you're enjoying it too. Certainly, if there's something you want to hear more about, drop me an email here at the chamber, and we'll do our research, and we'll see if we can't get a guest on for you to talk more about it. This podcast only happens because of the generous support of our quarterly sponsors, and this quarter, our sponsor is the great team down at O'Brien's Public House. So you've probably been there. If you've not been there, you've driven by it, and you should turn left and park in the parking lot and have dinner and a cocktail. So make sure that you stop in and say hi to them. They've always got great specials going on, live music. And I heard it from a great source today, Angry, the hot-headed Irishman, not to be confused with Scott O'Brien, although sometimes I do think they are confused for the same human being, that they've got purse bingo making its return next 2 weeks at the Deer Opener. So stay tuned for that. I know on all of their social media, you'll see that video. Our guests today were our gracious and generous first ever sponsors of this crazy little podcast. They took a chance on us when we said, hey, we've got this idea. What do you think? And they jumped right on board. And we're super grateful for that. Our guests today are Michael Morris, the Business Development Director and Interim Director of the Saints Foundation, as well as Monte Johnson, the Vice President of Medical Affairs, both from St. Francis Regional Medical Center. Welcome to the little show, guys.
Thanks, Angie.
Thanks.
Appreciate you being here. So we're going to kind of divide this interview up into two parts because we've got a different set of questions for each of you. But that said, you guys are friends and colleagues. Don't be afraid to jump in or interject if you've got something to say. So Michael, we're going to start with you because your title, for as long as I've known you, has been Business Development Director. And now you've taken on a part two of that, serving as the interim director of the Saints Foundation. I know you and I have had a couple of conversations about, oh my gosh, how this fundraising thing, how do you not lose your mind? And, what is the art of doing the chamber handshake? I must say you've mastered it well, probably all the years of service on the board that you've done. But tell us a little bit, I think a lot of people in town know what the Saints Foundation is, but give us a little history for those that don't.
Well, the Saints Foundation goes back a long ways, and it's a long, winding road. Thanks for the question. I want to be remiss if I didn't thank you for the opportunity to explain the history of it. But the foundation goes back a long ways. Historically, as you know, St. Francis and St. Gertrude's are both located on the same campus here in Shakopee. Historically, both of those organizations each had their own foundation. There was a St. Francis Foundation and there was a St. Gertrude's Foundation. And then about 10 years ago or so, those two foundations were combined. We had a lot of donors in the community and in the service area that said, hey, you guys are located on the same campus. You're asking the same people for money. Why don't you combine your ask and be a little more efficient? And foundation and organizational leaders at the time kind of said, hey, that's a good idea. We should do that as well. And so at the time, about 8 or 9 years ago, the foundations were actually legally combined into the Saints Foundation. Great. So we have a small staff that consists of employees of both St. Francis and St. Gertrude's. We have a foundation board that represents both organizations, and one philanthropic organization that works and has goals to support equipment needs and programmatic needs for both organizations, and has done so for the past decade or so.
Yeah. Well, and as a means of fundraising, every year you guys have held a gala. Some refer to it affectionately as the prom, the hospital prom.
Yeah.
I know my husband and I enjoy going every year. Tell us, you raise a lot of money at this event. Tell us what you use that money for, because I know every year you've got a different focus.
We do. And I actually, in getting ready for this first virtual gala that we're going to have on Saturday, and I know we're going to touch on that a little bit more. The gala historically has been owned by the foundation, both at St. Francis and St. Gertrude's, and then the Saints Foundation more recently. And then prior to that, it was held by the St. Francis Auxiliary. And the St. Francis Auxiliary, since the 50s, has these immaculate, very information rich scrapbooks that they kept. And those are in the hospital basement. And I dug through those looking for some fun old photos of old galas and information, and actually found a sheet of what the donations were used to purchase. And the first purchase that was made by donor dollars was way back in 1954. And they bought a vacuum cleaner for $133 and a TV for $267.
Wow.
And that was 1954. And they kind of they run the gamut of neat things way back in time. In 1966, a phonograph for the sisters that sponsored St. Francis was purchased for $112.98. Candy machine was purchased for $274. So it's a really neat, long winding road. And I think it's representative of the long history that both St. Francis and St. Gertrude's have of serving the Shakopee community. So it's a long, rich history of support by the community and then by the organizations to support the community. And they intertwine so much together and really complete the circle of support for one another.
Yeah. Well, and you've come a long way since the days of vacuum cleaners and phonographs. Although I do think, if you're going to live in a convent, you got to have some good music, right? So
That's
I'm
right.
all for that. I think I would have approved that purchase. But I know like one year stands out in particular to me for personal reasons, but you guys were raising money for your breast cancer center. And so, I mean, it's come a long way and you've done some amazing things for our community with this money. What are you raising money for this year?
The big drive this year will be to support the capital campaign at St. Francis. So as the community continues to grow, it's no surprise to anyone who's affiliated with the chamber that the community of Shakopee alone is double the size of what it was 20 years ago in 2000. That growth has been replicated throughout our service area as well, which kind of extends over east into Savage and south into Belle Plaine and then up north into Chaska. So our service area in its entirety has seen that dramatic growth as well.
Yeah.
Scott County and Carver County are the two fastest growing counties in the state. They kind of flip flop back and forth as far as who's number one, depending on the year. But you're right, we've shifted our fundraising focus from record players and vacuum cleaners to things that the community needs to stay healthy and really cure disease and illness, and really just to meet the needs of a growing community.
Yeah.
It was about 12 or 13 years ago when we did a Care North expansion. That's the curved tower that folks can see on our campus. We had an initiative at that time to raise about $40 million to help fund that expansion. This year, we're raising money to fund additional building expansions on campus. So we are in need of expanding the emergency room. Right now, looking at volumes for the past couple of years, we're 3 or 4 rooms short of the number of ED treatment rooms that we need to handle the current emergency room volumes that we have coming in.
Wow.
So
and if
a
growth
lot of the
trends
money
continue, if growth trends continue, you're going to need to expand even more than just catching up with what you need right now.
Right. And it kind of gets into a game of building whack-a-mole where we can expand one component of the building and that meets the needs for a while. And then we need to expand another part of the building to continue to meeting the health needs of the community.
Yeah.
But we're going to raise money to expand the emergency department just for typical emergency treatment rooms. We also have a big need to expand mental health rooms. We've seen dramatic growth in the number of mental health visits that we're seeing in the emergency room. And an emergency room is not the right place to see those patients.
No.
Part of the issue is there's really limited capacity on the inpatient mental health side downstream, both in the metro area and statewide. So there's not always a bed available for those patients who need one. So unfortunately, they get stuck waiting in the ER. So we need a better place, a more healing environment, a safer place for them, both for the patients and for our staff members. So a big component of the ED expansion will be focused on mental health.
Which is great.
Another focus of our fundraising will be on cancer center expansion. We've seen dramatic increase in cancer treatment at St. Francis that goes hand in hand with the population. So we're going to be doubling the size of oncology exam rooms, which will allow us to add more oncology providers to the campus.
Wow, the growth that I've seen at St. Francis, just in the 10 years I've been here, has been nothing short of phenomenal. And you just keep, as an organization, rising to meet the challenge. And so that as a resident of Scott County, we're not feeling those shortages, or at least I've not experienced that. I was just down there the other day for a well child exam for our daughter, and it got right in. And you guys are seriously, I would say, leading the way in, COVID preparedness. I felt incredibly safe, and it was all, and, I didn't feel like our service or our care that we were expecting was cut short at all, in spite of the fact that there's building going on everywhere. I even found a great parking spot, which was great. So you
Oh, good.
mentioned, Michael, that you've had to change the format of your gala this year. So, like everything else, it's gone virtual. Tell us a little bit more about that and what your guests and donors can expect this year. What are we going to see?
Sure. Like other galas, we had to pivot pretty quickly. Our original in-person gala was scheduled for April, and that's right after COVID hit us head on. So we adapted quickly and kind of pulled back a little bit to figure out what we wanted to do. And this new virtual gala kind of came on the scene, and we kind of sat back and watched several of those throughout the spring and summer and learned and kind of took the best from all of them. And hopefully we can implement some of the best takeaways from all the ones that have come before us. But it's certainly a new format, and we'll be jumping in with both feet this weekend on Saturday. But we've got a great program lined up that'll start at 7:30 p.m. on Saturday. It's free to attend. Folks who are interested in attending can find information at saintsfoundation.org/gala, and all the information about the event and the registration process will be there as well.
Great. And we'll put that on our visual part of this podcast too, so people can still find you. We'll hyperlink it.
That would be great. Thank you. We appreciate that. The program itself is going to be really exciting. We've got some really great live video components that will be part of this. We've got vocal performances from a woman named Jen Burley-Bentz, who is a local Broadway performer. She's a Minnesota native, but has performed on Broadway. And we have T. Michael Rambo, who's a local Emmy Award winner. They are a dynamic duo together, and they have done some amazing renditions of songs that I think people will know and recognize. And the chemistry between the two of them is really powerful. And I think if anything, hopefully it motivates people to give money to help support these healthcare expansions that'll be taking place at the hospital. And if nothing else, it'll be entertaining. So many of these galas are just talking heads that are asking for money and donations, but this one will have an entertaining component to it, which I think will be really appreciated, especially on a cold Saturday evening in October.
Yeah. Well, I will tell you, I've never felt like it was just a bunch of boring talking heads when I've come to the gala. It's always been entertaining. And
I'm glad to hear that.
It's always been entertaining and incredibly emotional. My biggest challenge every year is not, because you get your hair and makeup done, you buy a dress, you get, it's kind of fun to get dressed up and go to this party, and then to be sitting at your dinner table holding back tears and ruining your makeup. I'm kind of, like, I've never been bored, but I'm a little relieved I don't have to ruin my makeup this year or buy the dress, especially after the COVID-19 we've all experienced in my house. And I'm not talking about the virus. I'm talking about the added weight at our house. So Michael, one of my favorite parts about this gala every year, and my husband and I have a debate on whether I'm actually purchasing something or winning something for a good cause. I say winning, he says purchasing, tomato, tomato. But I'm assuming you're going to have auction items this year. What are some of the big ticket items that I should try to win?
Yeah, we will. And I failed to mention one of the most exciting things about the gala will be our speakers. We're fortunate to have Dr. Marianne Canning and her daughter, Elizabeth Deer, who are Shakopee natives. Dr. Canning was a longtime family practice physician in the community and a leader at St. Francis. And then her daughter, Elizabeth, serves on the St. Gertrude's board and leads the academies of Shakopee. So the two of them are local leaders, and we're excited to have them engaged as keynote speakers for us to kind of touch on the family approach, both as leaders within the two organizations and as local residents who utilize the healthcare services. So we're excited to have them be part of it. But to your point for the auction items, we've got some really cool items. A couple of the big ticket ones are a helicopter ride aboard Lifelink 3, which serves as the medical air transport company for St. Francis, the primary one.
Yeah.
It's actually owned by the three owners that own St. Francis, as well as some others. So that's a neat touch. But
Very cool.
it's coupled with a limo ride to and from the helicopter ride, as well as dinner and a 3-course dinner and wine pairing at Plate on Main and Prior Lake.
Oh, wow.
So that's a neat kind of one-of-a-kind unique experience.
Yeah.
Another one is tickets for 4 to the Medtronic suite at US Bank Stadium to watch the Vikings, and it'll have 4 on-field passes to watch warm-ups during a game next season. Hopefully we're not dealing with the COVID outbreak at that time.
Well, and hopefully they're winning next year.
Yeah, it'd be helpful if we had a little more of a winning record, but hey, it's fun access to a good
2020.
time.
Oh, absolutely. Don't think I won't be bidding on it. Yeah.
Another cool one is a virtual wine tasting. And the neat story behind this, it's a winery out of Sonoma, Healdsburg, California, called Bannister Wines. Mm-hmm. And Brooke Bannister is the proprietor and owner and winemaker there. But his mom, Marty, was actually one of the first female chemists in Sonoma County back in the 70s. And she opened a chemistry analysis shop, helping winemakers make their wine. And at some point in her career, in the late 70s, early 80s, she kind of said, hey, I've got this hard part down. I'm going to start making wine too, because that was where a lot of the money was at. So we'll have virtual wine tasting with Brooke Bannister from Bannister Wines. It comes from a really unique winery in the west coast of Sonoma County, right off the Pacific Ocean, called Campbell Ranch. Campbell Ranch is an old timber ranch that has been repurposed into winery. And it's, according to Brooke, it's the perfect spot and the perfect climate for making Pinot Noir. So that'll be a vertical flight with him virtually from Sonoma County.
Very cool. As a wine liker, I'm all in on that.
Yeah. Another couple premier items are an ice fishing excursion up I think it's Mille Lacs and Red Lake, but that's donated by Knutson Construction, who's doing our hospital expansion work.
Yeah.
And then with Brian Turtle's leadership locally on the craft beer scene in Minnesota, he's donated a craft beer and meal pairing at Turtle's Bar and Grill, and he will personally guide you through craft beer pairing for a meal that his staff will prepare in the kitchen, and you'll have the opportunity to explore different brews chosen by him that align with the meal that they'll be serving.
Oh, that's great. That sounds fun. And he knows his beer. You're right. He's leading that charge here. And so helpful to the 2 local breweries here in town with his, carrying their product and just promoting them. So that's great. So another downtown business, O'Brien's Public House, I heard today, our sponsor, is also doing food packs, including champagne that people can go purchase at O'Brien's and have for their meal the night of the gala. So it's sort of getting the full experience without having to put on the Spanx. The funds from those food packs are going to go to help your fundraising effort. Is that correct? Tell us more about that.
That's correct. This is a story of really true community partnership too, I think. And I'll go into detail on the O'Brien's opportunity, but it extends beyond that to the Shakopee Brew Hall as well. So I'll touch on both of those.
Okay.
But you're right. O'Brien's is working with us to offer meal packs that people can order ahead of time to go. And I'm looking on the screen as I look down through this, but there's an appetizer available. It's an autumn plowman's plate that includes toasted pumpkin hummus, artesian cheeses, prosciutto, flatbread crackers, and accompaniments. And there's 2 entree choices of rosemary rotisserie chicken and Guinness pot roast, and then a caramel apple turnover for dessert. And then there are 2 special drinks that the O'Brien's bartending staff kind of concocted for this event, and we'll be doing a virtual toast on Saturday evening, and they're both champagne based, and the instructions will be in the boxes, and it'll include the bottle of champagne that viewers can use to make those drinks.
I love that. What a fun idea. And this is Shakopee, right? Community partnerships, everybody's chipping in, everybody wants to be part of everything. And I think that's great. We're so fortunate down here. So Michael, we need to get over to Monte to keep talking about all things COVID, because our people are going to think they're on the wrong podcast if we're just talking fun stuff. But before we go, give our listeners the details. How do people still sign up? Where, how do they give them the details so they can get to your party Saturday?
Thanks, Angie. So one last thing is go to saintsfoundation.org/gala. All the details people would need are there, the links to register, the detailed information on everything. One thing that I forgot to mention, we do have watch boxes available for purchase on the bidding on the auction site as well. They include a bottle of wine, a fleece blanket, some socks, some treats.
Very cool.
And it will also include a special beer that the Shakopee Brew Hall beered for this event. It's a St. Arnold beer. St. Arnold was actually the patron saint of hop pickers. So there's a Catholic and even Benedictine association with this.
I love that. Well done. Well, thank you for sharing that information. And I am looking forward to the gala again this year. I'm so glad that it didn't get canceled, that you guys quickly pivoted, and I'm hoping to win a bunch of stuff. I'm sure John Whitcomb has other plans, but we all know how that's going to go.
Well, we'd love to have you there. Thanks, Angie.
I'll see you then. Monte is still with us.
I am.
I'm glad to hear that. So Monte Johnson, VP of Medical Affairs at St. Francis Regional Medical Center. We brought you on because you're probably smarter than Michael and I combined when it comes to medical specit things. So thank you.
Maybe medical stuff.
Yeah, we clarified that. Let's be clear. So, there's so many rumors and, false information. And I think I'm a big believer that people should have the right information before they make a decision. And especially when it comes to COVID. So talk to us about COVID in Scott County. What's really happening? What are we seeing? How are we doing as a community in flattening the curve and keeping you guys ready for us?
Yeah, well, thanks for the opportunity to visit with you a little bit about this. I think you're exactly right. Getting correct and accurate information out there is extremely important. I think, especially in times where we're seeing a little bit of an uptick here as we are, and we can talk about that in a minute if you want to as well. But that I would again direct folks who are listening or viewing or tuning into this podcast to consider visiting the Minnesota Department of Health website. They have a fantastic website. We're very blessed in the state of Minnesota to have a premier public health infrastructure led by the Minnesota Department of Health, and they have a fantastic website with a daily situation update that gives all kinds of statistics that are accurate and true, and a very good source of information. So again, the Minnesota Department of Health is where I would direct people if they want to find out more. But when it comes to Scott County, I think we're seeing in Scott County what is happening in the rest of the state, and that is a little bit of an uptick in the COVID activity right now as well. I looked today on the Department of Health website, and so far in Scott County, over the course of the last several months, we've had a cumulative total of about 3,200 positive COVID cases in the county. Right now, about 6.1% of folks who are getting tested are positive for COVID.
Okay.
It's still a relatively low number. It's a little bit higher than it was. It had been kind of hanging down in the 4 and 5% range for a while. It's ticking up a little bit there. And then, in terms of a rate, what we're seeing is about 210 COVID cases per every 10,000 people. So, just a few different ways to look at the same data. But are seeing a little bit of an uptick now. The biggest spike in COVID activity that we had in the state, including in Scott County, was back in May. And after, as May moved into June and kind of late June through July, August, and even much of September, we saw just kind of a low level of activity with occasional little bumps in the road in terms of increased number of cases. But we are at a point now where we're seeing an uptick that is not quite to the level of May, but seems to be going up more than we've seen since then, and we're all kind of keeping our fingers crossed that it doesn't get back to that. But
so, Monte, with that uptick, how many of those positive cases are leading to hospitalizations? And is there a certain population that is making that number up?
Yeah, so the hospitalizations in Minnesota, I was just looking at, it's about, it tends to be, hospitalizations tend to be somewhere between kind of 18 and 20% of cases, it seems like.
Okay.
And of those who are hospitalized, about 10% end up being admitted to the ICU, needing that level of care. The good news is that even though hospitalizations kind of tick up as the activity in the community ticks up, the good news, I think, is that we've had a lot of time to prepare and be ready, which is great. And then we've also, I think, learned a lot about COVID and the virus and the illness itself, and really come a long way in a pretty short period of time in terms of being able to treat folks who need hospital level of care even better than we would have been able to several months ago.
Yeah. So how has St. Francis kind of weathered the pandemic thus far? I mean, have you seen staff shortages? Have you had to furlough? How's your PPE supply? Can you take more patients? I mean, tell us how our hospital is doing.
Yep. So our hospital has had a similar experience to many hospitals in the state and across the country, in that, it was kind of ironic that an illness created a great deal of difficulty for health systems in the sense that, patients were really not coming to the hospital early on. And whether that was out of fear or stay-at-home orders or, all those kinds of things, our volumes dropped substantially. We also had to stop doing many of the elective surgeries that we do quite a bit of in our hospital. And we had to do that because we needed to conserve PPE supplies and staff and other resources that we might need to be available and ready to care for patients who might have COVID. We've been able to resume much of the normal activity in our hospital. And like I mentioned, over the last couple of months, we've had relatively low levels of COVID patients in our hospitals. So we've gotten back to doing surgeries and taking care of whatever needs people have here. I think I'd also, like to just say we as a hospital and Alina and Partner Good Health Partners and Essentia, our ownership partners, all those organizations have done a tremendous job of making sure that it's safe to come to our hospital. If you need care, I wouldn't stay home and avoid coming to the hospital. It's very safe to come to our hospital. We've put in all kinds of safeguards and processes to make sure that it's as safe as it can possibly be. So I think we went through a tough time in the early months of this. We're getting back, kind of digging our way kind of back out of that. And we did, we like many hospital systems had staff who had to be on furlough or took some time off or whatever. Luckily, we're getting a lot of those folks back to work now, which is fantastic as well. And our PPE supplies, one of the blessings of the good job that I think Minnesotans and Scott County residents and everybody did early on was staying home and following the guidance of our leaders that gave hospitals time to catch up. We had an opportunity to acquire more PPE supplies and make sure that we had additional beds ready and those kinds of things. So we're ready. We have our PPE supplies are really in a much better place than they were even 2 or 3 months ago. And if we do see another uptick, I think we're going to be much better prepared to handle that than we were early on. So.
Good. Yeah. I think at the beginning, we all did. I mean, at my house, we just stayed put. Yes, sir.
That's the right thing to do, right? I mean, that's I think we talk a lot about COVID fatigue. We're all kind of tired of being home and, sports are different and our kids' activities are different and our lives are socially different. But, I guess that it's really important that we continue to kind of pay attention to what the experts in our community and in our government are telling us around what we should be doing to prevent the spread of this and make sure that, there's resources available for those who end up catching COVID.
Yeah. We kind of look to you, at least, here at the chamber, just because of your affiliation and you guys have been such great supporters, but we kind of view you as, our own little doctor, our own very own Dr. Fauci, right? So
that's a huge compliment. Thank you.
Right. Yeah. So, but you just brought up something, Monte, that I was going to get to, but I'm going to touch on it now. Like, as we learn to kind of live with COVID, and now they're saying it might become an endemic and, it's not going away. We're just going to have to figure out how to manage it and stay ahead of it. What changes that have been implemented in the last 9 months do you kind of see becoming the new norm? I mean, are we going to be the society that we will always see people walking down the street with masks on? And or what do you see?
Yeah, well, at least for the foreseeable future here, I think that's true. I think we know that masks do protect others from us. That's the main point of a mask, is to protect other people from what's coming out of us.
Yeah.
And so if we all wear those, we do a much better job of protecting each other. I think we're going to have to be really good at washing our hands. I mean, there's hand sanitizer everywhere now. You just about can't go in a door anywhere and not run into hand sanitizer. So make use of that. I mean, I think the masks and the hand sanitizer are things that'll go a long way. I think, I think we are going to be sort of in a kind of a new normal, at least for the foreseeable future. I don't know what that means. I don't know if that means 6 months or a year or what, but those are really important pieces that we can do. And I think, as we get into the holiday season, and especially in Minnesota, where, the weather's turning colder and, we're kind of all forced indoors, I think it's going to be really important that we pay attention to, small groups, trying to stay in kind of your own little, closed envelope of people as much as we can. It's a challenge. It's going to be a challenging time in Minnesota where we can't be outside all year round. And, I think we're going to have to learn how to do Thanksgiving by Zoom, probably on some level. I mean, I think, there's all that kind of stuff to really think about. And I guess, there are folks who are thinking a lot about this at the Department of Health, and I think we can just kind of continue to look for their guidance and follow their lead in terms of how we do things like group gatherings and what size is safe and is it, how do we handle the holidays and those kinds of things.
It might be the most peaceful holiday season yet. If we're not gathering, there can't be any conversations about politics and family feuding, right? So
right. Well, you can just mute your crazy uncle, when he goes off the rails, you can just kind of mute him or whatever, and that'd be perfect, I think.
See, you got to look for the silver linings in this chaos. Although I do look out my window and see the snow and think, come on, man, like it's a little early. We've just got out of our houses, it feels like, and now we're being shoved back in. So, Monte, we just have seen the highest daily death rate in Minnesota since late May. And with the majority of those still, according to the data, being at long-term care facilities like St. Gertrude's, but they also just turned the dial. So, loosening that we can go in and visit our loved ones. I mean, what recommendations, and first of all, how do you feel about that turn of the dial? And what recommendations would you give to families, especially as the holidays are coming, they're going to want to go see grandma, grandpa, or their parents? What recommendations should we follow? Should we not go do it? Or do we show up in a hazmat suit? I mean, it just seems reckless to me, but.
Yeah, it's a tricky decision to make, right? And I think you're right. They just have kind of relaxed some of those restrictions a little bit. It would not surprise me if COVID activity and rates continue to positive rates continue to go up. If they turn the dial back the other way at some point, that wouldn't be a surprise. I think the best advice I could give to folks is if you're sick, don't do it.
Yeah.
If you're feeling ill, or if you have symptoms that you think might even be a little bit related to COVID, my advice would be don't go. And if you are going to go, if the facility that you're going to visit allows folks to come and visit, do the things that we talked about a minute ago. Make sure you have your mask on. Make sure you're using the hand sanitizer frequently. Make sure that you're keeping, at least 6 feet, if not more, between you and your loved ones. Just those things alone go a long way in mitigating the spread of this virus. We know that, and so the more we can do that, the better chance we have of avoiding bringing it into those facilities where the most at-risk folks live.
Yeah. Well, good advice. I just, I tend to try to weave common sense into too many things, and it doesn't always fit nicely. But this hand washing, I find it just gross that as a society, we're still talking about like, oh, you should wash your hands. That should just be a given, right? That shouldn't be like oh, hey, have you ever thought about washing your hands? It's just kind of gross. We learned it in kindergarten. Yeah. So, all right. So one more question about COVID for you, Monte, or Shakopee's own Dr. Fauci. So obviously going inside, and we're starting to see the data show that, we're getting that second wave. It's going to peak again, whether it's as bad as the first or not remains to be seen. But there's also a lot of talk about a vaccine, and that it's on the horizon, and we're fast tracking testing, and they're already mass producing it. What are your thoughts on that? Like, when do you think we'll see it? How long? I mean, and seeing it doesn't mean, okay, lights on, we're back to normal. What should we expect as a rollout and a timeline? And is it going to be like the flu vaccine where, we all got our flu shots, but what if I get a different strain than the vaccine? Give us the real scoop on vaccines.
Yeah, well, what I would say about vaccines is that I would say, first of all, that the effort by the pharmaceutical industry in this country to develop a vaccine on this timeline is unprecedented, and it's been really impressive to watch. There are a lot of really smart people working day and night on getting a vaccine together that's going to be effective. When do I think we'll see it? I don't have any idea. I think, if you listen, I tend to listen to the experts. I tend to listen to Dr. Fauci on this issue, and what they're telling us is that they expect that we may have a vaccine that's ready for distribution by the end of this year or early in 2021. And I think that's what the experts are telling us is a realistic timeline. I think it'll be really important for us as a society to pay attention to what the experts are saying around its effectiveness and how it works and its safety. I think there's nothing that would be worse from a public health standpoint than putting a vaccine out there that's either ineffective or unsafe. That just undermines everybody's confidence. So pay attention to the experts. The Dr. Fauci's and the folks who do this every day professionally for a living. When they tell us it's time to take the vaccine, then it's time. And I'm hopeful that we can have something by, and that there's something that's ready later this year, early 2021. The next piece of that, though, is the distribution piece. Think about trying to distribute a vaccine to the entire world, right? We have to think about who gets it first, who's most at risk and who gets it first, what country gets it first, how much does each country get? It's not like you flip a switch and vaccinate everybody and the next day things are great. It's going to be a long process. And I don't mean to sound like a downer in that way, but I think setting realistic expectations, around this is important, because until we have that available and until we get enough people vaccinated with an effective vaccine, we're going to be doing the things that we've just talked about for the last 15 minutes. And so, I think if we're lucky enough to be able to widely vaccinate everybody by the spring of next year, that would be amazing. So.
I'll take it. I mean,
Yeah,
I've got maybe the rest of this school year left in me, but if we're not back to normal school next year, I'm going to need something stronger than a COVID vaccine.
Yeah. Well, I get it. Yeah, I mean, we all have those same challenges. I mean, we've seen one of the Morris girls adding to her component of this here as well. We're all doing things differently, and
it's fantastic.
Which is awesome, by the way. It's cool, but yeah, you're right. And I think, like I said, I kind of mentioned COVID fatigue at the beginning. And if I could just, add one more imploration to this is that, just really double down on your efforts right now. I know it's hard and it's no fun and we're all moving indoors, but the more that we can pay attention to masks, hand hygiene, and social distancing, we are going to be in a way better place in 6 or 12 or, 18 weeks than we would be otherwise. So try to push past the COVID fatigue, keep doing what you're doing. It has worked. If you look at the states around us, Minnesota is actually functioning and faring much better than the states around us. So, that should be reassurance and proof that what we're doing has been working, and we should keep up with it.
Yeah. Yeah. Well, I thank you guys both so much for being our guests today, for being our first sponsors of this little program, and then one of our first guests with our new sponsors. So we appreciate that. Thanks for all the work you do for our community in keeping us safe. And Michael, best of luck to you and the rest of the foundation team at this weekend's fundraiser. I will be on my couch with a cocktail, winning lots of stuff, hopefully.
I would just say, Angie, too, as Michael's colleague here in the administrative office at St. Francis, I mean, he's just done an amazing job of picking up the ball and running with it, and and pivoting and kind of rolling with everything that's been thrown at him with this pandemic from a foundation standpoint. So it looks like a fantastic event. I agree, it's going to be a lot of fun, and appreciate all Michael's work to help us particularly from a physician standpoint. The guy who's kind of in charge of quality, safety, and the care that we provide around here. What the foundation does is amazing, and is very much needed and appreciated. So I appreciate his efforts around that, and I appreciate the audience participating and helping us out as much as they can.
Yeah, well, we will put the information to still register, and they can register as late as Saturday when it starts, right, Michael?
Right. You can tune in right on time. And it's, as you're sitting on your couch, one little nugget I'll throw out there is we're encouraging people to send in pictures of them in their pajamas and tiaras to Saints Foundation at alina.com, and we'll post those during the live stream.
Fantastic. Well, now there's a little pressure to get cleaned up. Dang, I thought it was going to be like a first virtual without actual Zoom, but we'll take a picture from the Whitcomb household. Guys, thanks so much. And we will put all of the information for the Minnesota Department of Health, as well as the Saints Foundation Gala, on our website and on our social media. So make sure you tune in. And we want to thank our friends at O'Brien's Public House for not only supporting this gala and being partners, but also supporting our podcast this quarter. So if you haven't been down there, stop in, check out their social media, and tell them the Chamber sent you. Thanks so much. Have a great week. We'll see you next week.